Hello and welcome to It's Personal, brought to you by Gundersen Health System. Coming up, you'll learn about how Lyme disease is spreading across not only Wisconsin, but really the upper Midwest, and how you can recognize the symptoms of Lyme disease. Also, the sun and your skin, not a good combination. Learn why more and more women are developing skin cancer rather than men. And later, you've heard of the 5-second rule? You know, the one where if you drop something on the floor and pick it up within 5 seconds, it's okay to eat? We're going to ask an expert about a new study on the 5-second rule. All next on It's Personal, brought to you by Gundersen Health System.
Are you confused by all the talk about the healthcare marketplace and insurance exchanges? There's just one thing you need to remember. GundersenOne. It's a new option from Gundersen Health Plan, which is locally owned and operated. If you need to purchase health insurance for yourself or your family, GundersenOne offers a choice of plans to fit your budget. To learn more or to enroll, visit GundersenOne.org or call the Gundersen Health Plan Enrollment Center at 608-775-8092. That's 608-775-8092.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Tick season is upon us, and I don't know if you're ready for it, but the ticks are. And more importantly, are you protecting yourself from things like Lyme disease? Dr. David McNamara, Gundersen Infectious Disease, is here to explain. First of all, can you define what is Lyme disease? And I know that's kind of a difficult one to try and tackle right off the bat.
Yes. So Lyme disease is a common bacterial infection that unfortunately we actually see a fair amount of in this region of the upper Midwest, and it's caused by a bacteria called Borrelia burgdorferi. It's transmitted from the bite of an infected tick.
Where did this come from? Has this been around for centuries, or is this more of a recent thing, or do we know?
So Lyme disease and the bacteria has probably been around for a long time, probably centuries or thousands of years. It's only really been recognized and well studied in the past 30 or 40 years, and it gets its name from Lyme, Connecticut, which is where the first cases were first identified and the infection was really figured out in the mid-1970s in Connecticut.
Can we talk a little bit about some of the regions where Lyme disease is more prevalent? Because it seems like here in the greater La Crosse area, it's quite prevalent. Where else in the country besides Connecticut and, Wisconsin?
So the two major areas that have Lyme disease in the U.S. are the northeastern U.S. So all along the Atlantic seaboard, from the mid-Atlantic states up into the northeast, has quite a bit of Lyme disease. The other major region that has Lyme disease is the upper Midwest, and Wisconsin is really the hot spot of that. So we see quite a bit of Lyme disease in Wisconsin, Minnesota, some into Iowa, even into Illinois. And the geographic spread of Lyme disease in the last 1 or 2 decades is significant too. So it's expanding outside of just this western Wisconsin area, really spreading all through Minnesota up into North Dakota in the last several years.
Interesting, it's spreading. Is there a reason that scientists are feeling like it's spreading? Is it the mild winters, although maybe not this winter? Is it mild winters? Is it the prevalence of deer? Is it a combination? What's the theories out there?
So the main thought is that it probably relates to milder winters and climate change, and spread of the ixodes or black-legged tick. Sometimes people call it a deer tick, which is, we think, been able to survive better in the milder winters in the last few years or even few decades.
So this past winter has maybe been, a boon for for infectious disease doctors, then, if you will.
You bet. So from an ecologic standpoint, infectious disease doctors, appreciate the value of a real deal old-style winter, because that has effects on the ticks, the trees, the whole ecosystem in our region that really, we as humans we're living in conjunction with a lot of other animals, certainly ticks, other mammals and birds in our environment, all of which can contribute to spread of infectious diseases to humans.
We're talking with Dr. David McNamara, Gundersen Infectious Disease, about Lyme disease. Of course, when people think of Lyme disease, you can't really identify, I wouldn't say, a specific group of symptoms, because I've heard you say in the past that a lot of times the symptoms are extremely varied. Can you talk about that and why that's the case? Is it because it's a bacteria infection?
So most people who have Lyme disease will usually have some symptoms in the beginning, and the symptoms can be quite varied. So diagnostically, for the healthcare provider, it can be a hard infection to recognize. Many people will have a classic red, some people call it a bullseye rash. Usually it's actually more of like a red blotch, often an oval or an oblong sort of circle. Many people will have that with the recent acute infection. And if that's recognized and treated, it's the treatment with standard course of antibiotics is extremely effective. One problem is that there are probably maybe 30 to 50% of people who acquire Lyme disease who don't develop that characteristic, what we call erythema migrans rash. And if they don't have the rash, it's tougher to recognize Lyme disease. Many people at that early stage would have a flu-like illness with fevers, fatigue, aching, just sort of feeling unwell. And that's really a tremendously non-specific type of illness.
Very interesting how Lyme disease presents. And I know that many patients believe that they have Lyme disease, and I don't know if the right word is controversial, but sometimes they see the symptoms on the internet and say, oh, that sounds like what I have, but from an infectious disease standpoint, it gets to be kind of difficult to explain to a patient maybe that they don't indeed have Lyme disease, that they might have something else. How do you deal with that?
The difficulty is that symptoms of chronic fatigue or joint aching or feeling unwell really could be caused by a really wide variety of different illnesses. They're not really specific for Lyme disease, and we want to be, rather careful and, in a sense, judicious in terms of making as precise of a diagnosis as we can. Both, I think it helps patients to know what kind of an illness they have, and also for physicians really to guide good treatment.
We're talking with Dr. David McNamara, Gundersen Infectious Disease, and before you go, we have to say, how do you avoid Lyme disease? Is it possible?
This is a real challenge in this region. As physicians, healthcare providers, we want to do everything to tell our patients, get outdoors and be active. The big risk in this region is we're being active and we're doing outdoor activities with our family and our friends in areas where there's a lot of brush, there are forests, there are trees, so we have risks of having ticks on us. Things that we do, we use insect repellent, which can be helpful for people who are real avid outdoor enthusiasts or people who are hunters where they're going to be in brush, often using permethrin treatment in their clothes or their hunting gear can be a helpful thing to help repel ticks. We strongly encourage people when they come in after being out of doors, if they're out hiking and active in the woods, strip down, take a shower, do a good all-over body check for ticks. The ticks that transmit Lyme disease really are tiny. They're about as big as the tip of a sharpened pencil. So many people who have Lyme disease really can't recall having a tick bite. So it's tough to see the ticks, but if you do see a tick, or if your spouse is checking your body carefully, try and get the tick off with some tweezers. But doing a tick check, checking your children, after you've been outdoors in the woods is important as well.
Great advice. Dr. David McNamara, Gundersen Infectious Disease, thank you.
Thank you. It's good to be with you.
For more information about Lyme disease, go to the Gundersen Health System website. That's gundersenhealth.org. Coming up next on It's Personal, the sun and your skin. It's not a good combination. Learn why more and more women are developing skin cancer than men. We'll tell you what you need to know. All next on It's Personal, brought to you by Gundersen Health System.
Wow, what a great game. But that meatball sub, it sure gave me heartburn.
You're sweating and breathing kind of hard. Are you sure you're okay?
So I got a little worked up over that last play. What are you, a doctor or something?
No, but I read that chest pain from a heart attack can be mistaken for heartburn. Does it hurt anywhere else?
My arm aches some, but armchair quarterbacking is a tough job.
That's it. You're going to the ER.
Is it heartburn or a heart attack? Gundersen Health System urges you to learn the difference. It could save a life. Go to gundersenhealth.org/chest-pain.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Skin cancer is a deadly killer, and actually one of the cancers that is on the increase. And Dr. Stephen Webster from Gundersen Dermatology joins us now to talk a little bit more about skin cancer. First of all, skin cancer more prevalent these days?
Unfortunately, it's one of the cancers that is increasing in incidence, and we're concerned about that. We're particularly concerned about the increasing incidence of melanoma in women. That is fairly significant.
What's causing that?
Over the past 40 years, there's been a 3 to 4% increase every year in melanoma in women. And that's the time when the tanning booths came in. And it seems to be a significant association with the tanning booths because the UVA rays are actually more intense in the tanning booths than from the natural sun. So that's a grave concern for us. Used to be that melanomas were just seen in older men, rarely in women. Now we're seeing them in women more frequently, and particularly in younger women.
Not to sound maybe sexist, but it used to be that the old farmers were out there and in the sun, and they were getting all the sun, and now it's different.
Exactly.
Yeah, we're seeing women who want to get that base tan before they go on vacation or there's a wedding or that kind of. What's your advice to them?
Well, the first thing I say is if the skin is tanned, the skin is damaged. Tanning is a result of damage to the skin from the ultraviolet light rays, so there's no such thing as a safe tan. Secondly, there is a significant association of ultraviolet light and skin cancer. So you are getting a tan, but you are increasing markedly your risk of getting cancer. It's a more direct association between that than there is cigarette smoking and lung cancer.
A lot of people say, I can't avoid the sun. I'm working in the sun. I'm out in the sun all the time. How do I protect myself against the sun? Is sunscreen enough?
Well, first of all, you need to remember that the sun is most intense from 10 until 4 in the middle of the day. So if you can have your outdoor activities after that, it's very effective. Secondly, in the wintertime, when it's cold, particularly like our winter we've had this year, you wear a coat when you go outside to protect yourself from the cold. Well, you need to wear proper clothing when you go outside. We recommend a hat with a 3-inch brim that protects the ears and the sides of the face and the back of the neck. Most people wear the baseball caps, which offer a little protection in front, but nothing on the sides and the back, so we're trying to get people to wear a hat instead of a cap. Secondly, they have sun shirts that are long sleeve shirts made of a very tightly woven material that's very lightweight, comfortable to wear in the summer, but it does block the rays, and we encourage those. Thirdly are the sunscreens, and people have to use the sunscreens properly and know that they're getting the right sunscreen for what they want.
Dr. Stephen Webster joining us from Gundersen Dermatology. Sunscreens, I know that there's some new rules involved with sunscreens, better ratings. Is that? Yes. Can you explain that?
The FDA has improved the labeling of sunscreens. First of all, they, on the sun protective factor, which is a number which indicates how much longer you can stay out in the sun without getting a burn, we recommend a sun protective factor, SPF, of at least 30. when you get above 50, there's very little extra protection. So now many of the labels will not say 80 or 90 or 100, they'll say 50 plus. But we recommend it should say at least an SPF of 30. Secondly, you'll see the term broad spectrum on the sunscreen. That means it protects against the entire ultraviolet light spectrum, and that is particularly important because many of the older sunscreens protected against sunburn by blocking the shorter UVB rays, but they didn't block out the UVA rays. Those are the longer ultraviolet light rays, and those are the ones that produce the aging of the skin. The wrinkling of the skin is due to the UVA, and also the increase in melanoma appears to be associated with the longer UVA. So it should say broad spectrum on it.
Two more questions around sunscreen. One of them, if you have sunscreen that you've got left over from last year, is it okay to use it this year? And then the other question is, what about kids in the water and going in and out of the water with that sunscreen?
Well, we recommend, first of all, that sunscreen should be applied 20 to 30 minutes before you go outside. Don't go outside and start to sweat and then apply it. And secondly, we recommend applying it every 2 to 3 hours. Whether you're just sweating or swimming in and out, but that 2 to 3 hours is reasonable. Right now, there's no such thing as a waterproof sunscreen. They used to have that on the labels. Now it will say water resistant for 40 minutes or water resistant for 80 minutes. They have to specifically show that they've proved that. The other thing is on the aging of the sunscreens, it differs with whatever vehicle is used, but if it's over a year old, it should not be used. It's probably inactive and should be thrown out. So I recommend people don't buy a huge economy size tube in September and then start to use it next year. Use the smaller, use it up, and so on. It will have a date on it.
Good advice. Let's talk, if we can, briefly. You do skin cancer screenings around the region and the greater La Crosse area, all over, really. What are you looking for? I mean, obviously skin cancer, but what should I be looking for on myself?
Well, first of all, we recommend that people get in the habit of doing skin self-examination. This is analogous to women doing breast self-exam. If they're used to examining the breasts, they can tell if there's a change in the texture of the tissue and so on, and they can come in early. If you get to the point where once a month, once every other month, after your bath or shower, you say, okay, I'm going to take 3 to 4 minutes and do a skin self-exam, and you look at your entire body. You look for any new lesions, any sore, crusted areas that aren't healing, a warty type lesion that is rapidly growing, or a mole that is changing. And that, if you're used to looking at your skin, you can pick up those changes very sensitively. And that's what we want. With the moles, we tell people to look for A, B, C, D, E. A stands for asymmetry. If a mole is not symmetrical, if it's asymmetrical, that's a danger sign. B is border. If it has an irregular border, that's of concern. C is color. Not if it's dark or light, but if there's a variation in color. Different areas or it's changing color. D is diameter if it's bigger than the head of a pencil, but more importantly, E if it's evolving, if it's growing, that definitely should come in early on. And with skin cancer, if they're seen early and can be removed early, there's a very high cure rate. If the cancer has gone deeper in the skin and is spread elsewhere in the body, particularly with melanomas, our chemotherapeutic agents are not as effective. So we really want people to come in with any lesion they have any suspicion of.
Dr. Webster, great advice. Before you go, one final thing. I know you wear a wide-brimmed hat all summer long. That's your recommendation too?
Absolutely, absolutely, and I would wear it all year around. For one thing, if I ever got a sunburn, my nurses would chew me out something fierce, so I go out of the way, but it's not that hard to be sun safe with proper clothing, wide-brimmed hat, and sunscreen.
I've heard you say before, people use sunglasses all summer long. They should use sunscreen all summer long,
That's
too.
right.
All right, Dr. Webster, Dr. Stephen Webster, Gundersen dermatologist, and we thank you for your time.
Thank you.
And if you'd like more information about skin cancer, be sure to ask your regular doctor or go to the Gundersen Health System website. That's gundersenhealth.org. Coming up next, have you heard of the 5-second rule? A new study has looked at whether the 5-second rule is safe or not. But we'll have our own expert weigh in. I'm Christopher for It's Personal, brought to you by Gundersen Health System.
Between kids, the dog, working, and housework, it's hard to know where it all ends sometimes. But when it comes to your family's health, Gundersen Health System is where it begins. We understand you lead a busy life. That's why we provide most of the care your family will ever need, right nearby. From annual exams and broken bones to treating illnesses and chronic conditions, Gundersen is where health begins for your whole family. Need a primary care provider? Visit gundersenhealth.org/families.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Christopher. A new study says that the 5-second rule applies. Bridget Path from Gundersen Infection Control joins us now to discuss the 5-second rule, which is the rule where you drop food on the floor and if you pick it up within 5 seconds, it's safe to eat. Bridget, this new study, first of all, maybe we need to talk about the study, says it's okay to do that, but can you debunk the study a little bit?
Well, I think the first thing to discuss related to this study is that, in fact, it's really, in the scientific community, it hasn't reached publication stages yet. It's not a peer-reviewed study that's been published. It's sort of a science project that has a lot of controls in it. They looked at several different surfaces, different food types. I kind of, for myself, sort of use the personal rule of if it's chocolate and it fell on the floor, 5 seconds definitely applies. But certainly looking at, how do we know which bacteria or viruses are on the floor surfaces that we drop the food on? What's the risk of dropping something on the floor in the barn versus dropping something on the floor here in the hospital versus dropping something on the floor in your own kitchen? Does the rule apply differently to different areas versus different surfaces? I certainly think there's lots of questions still related to the 5-second rule.
The common sense, I think, probably comes into play here, is what you're saying, Bridget. But from an infection control standpoint, what kind of nasty things are out there on the floor? I mean, I think most people think that, you drop something on the kitchen floor, it's going to be okay if you get it, pretty quickly, because kitchen floor, we try to keep it clean for the whole house.
And I think this lends to some of those other questions that people have. Which things are spread by the environment? If I dropped it on the floor versus dropping it on the counter versus certainly lots of questions still. If I dropped it in my own kitchen, that certainly applies differently because it's clean. Nobody in my household is sick. It changes when somebody is sick. Maybe there's more bacteria or viruses around. In this particular study, they looked at E. coli and staph bacteria. Many of them, if a couple of them got onto a food product, wouldn't probably make you sick. Norovirus, this is the particular virus that sometimes brings cruise ships back into port because the outbreaks only require 10 viral particles to make the next person sick. Cleanliness is one of the key things to ensuring that you have minimizing of the spread. 5-second rule or no 5-second rule, you definitely need to look at surfaces in your home and ensuring that you're keeping them clean.
Now, I've heard you say sometimes, people's hands are dirtier than the surfaces around them. Can you talk about that and just about, keeping your hands clean, why that's so important?
Well, I think we could start down a whole different pathway too of, not only that, or what bacteria is on the food when it comes to you. Have you washed your fresh fruits? Have you, we are covered in bacteria on the inside and outside of our bodies. If you're in a public place, washing your hands before you ingest food is key. Keeping a little hand sanitizer close by your person if you're out in a public restaurant might be, an idea as well.
Let's talk a little bit, as long as we're on the subject of, the household. What are some of the places that are maybe the worst places for, bacteria or, even viruses that, in a typical home?
Well, in a typical home, you're going to have a higher bioburden wherever there's water. So in showers, bathrooms, around your kitchen sink, and thinking of anywhere, have you thawed out some meat and not disinfected your countertops? Those would be the types of surfaces I would look for. I would also think about if you've got pets in and out of your home. Cat litter boxes are a place where there are certain things that can make pregnant women very sick. So thinking through, what areas would I be worried about mostly in the home? It would be anywhere where there's water and sinks. And for myself, maybe my teenager's bedroom.
Let's talk too then about what are some of the public places that people should really, think about washing their hands. Obviously, eating is one of those spots, but where else?
Well, thinking about the grocery store, there's also many studies that talk about whether or not that cart has bacteria and where those bacteria come from. Again, thinking about not just the bacteria that come from the other people around you and their hands, but the bacteria that are coming from the food. Often we're seeing antimicrobials being used in animal food, so the turkey or chicken that you pick up might have some antibiotic-resistant bacteria, or these superbugs, so-called, on it. Fresh fruits and vegetables will have bacteria on it. We expect that food has some bacteria on it. Is it going to be enough to make us sick? Am I washing those items before I ingest them? All the reasons why we improve or add those hygiene philosophies into our daily lives is to minimize the risk of that spread. Using that common sense approach, there we go again, out in the community when you make a decision of whether you ingest something. So just like that 5-second rule, thinking through, what I just did, should I be washing my hands? Or if I'm walking through the grocery store and I'm picking up these bacteria, should I be putting my hands near my mouth, near my nose, near my eyes? There's so many tangents we could go down with the bacteria and where they are in the environment. That the 5-second rule is really just the tip of the iceberg for that.
We're talking with Bridget Path. She's infection control at Gundersen Health System. And Bridget, before we let you go, I do want to say I know a lot of those offices out there have that refrigerator stuck in the corner with the science project in the corner. Any advice for them?
That's certainly an area that we think about and talk about a lot here. We have certainly patient food refrigerators, and we have strict protocols for them. Your office refrigerator, I've heard of people who found something from an employee who terminated 5 years ago, moved to another community. I guess we're not sending them their lunch bag. But definitely assigning responsibility for office refrigerators is key.
Once a month? Clean it once a month?
Once a month seems like a safe way of handling that. Using the practice of dating multi-use items when you open them, not because you need to follow anything different than the outdate that's already printed from the manufacturer on something like a salad dressing, but it helps you find those things that maybe did belong to the person who hasn't worked at your facility for more than 5 years. Initials and a date is maybe a good practice if you're working through a community refrigerator. I sort of, probably again a bit eccentric about my home refrigerator with evaluating and making sure that things have good turnaround time within the refrigerator. But the office refrigerator can sometimes be a very dangerous place.
Sometimes I think when you think of the 5-second rule versus the 5-month science project in the back of the corner of the refrigerator, they don't really seem like they're on the same par at all. Bridget, thank you for your time. Much appreciated.
Yes, thank you.
And by the way, if you'd like more information about any of the topics discussed on the show today, you can go to the Gundersen Health System website. And when you're on the website, be sure to sign up for MyCare. You have access to your provider and your health information all right there, all right at your fingertips. And you can do that by going to GundersenHealth.org. And that wraps it up for this edition of It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Thanks for joining us.